Caitlin Cooper. I'm a nursing student on the Beach Unit at the Heartland Healthcare Center in Ann Arbor. My patient is a 93-year-old widowed Caucasian female. She spent most of her life as a cook before retiring in 1992. She was transferred to the Heartland Healthcare Center from St. Joseph Hospital on January 2nd of 2013 and is currently wheelchair-bound. My patient presented to the facility with COPD, hypertension, breast cancer, dementia, diverticulitis, and enteritis. At the time of examination, her blood pressure was 148/88, heart rate 74 beats per minute, respirations 21 breaths per minute. She rated her current pain level as a 1 on a scale of 1 to 10, and she is currently A&O times 2 to 3. History of present illness. My patient was diagnosed with breast cancer 4 years ago and underwent a right-sided mastectomy last summer. Most of the cancer was removed, and she is not currently receiving chemotherapy. My patient was diagnosed with COPD in 2009, diagnosed with dementia related to Alzheimer's disease in 2011. Several weeks ago, she was diagnosed with diverticulitis and enteritis and is currently taking several medications for related abdominal pain, nausea, and diarrhea. On March 10th of 2013, she underwent endoscopic surgery for peptic ulcers and has had no further complications. 10 years ago, my patient had both knees replaced and her left hip replaced. In 1998, she received surgery for carpal tunnel on her right wrist. Due to my patient's diagnosis of COPD, diverticulitis, and enteritis, her respiratory system and abdominal systems are of high priority to assess. A respiratory assessment is especially important for a patient with COPD because we as nurses must ensure that our patient is receiving adequate oxygen. Review of systems, respiratory system. Patient denies shortness of breath and cough at the time of examination and states that she sometimes coughs excessively and it becomes difficult to breathe. Patient denies history of respiratory disorders yet acknowledges her diagnosis of COPD. Patient stated that she takes an inhaler when she coughs but did not know the name of the medication. Patient stated that today it was easy to breathe and denied chest pain, but stated that chest pain sometimes accompanies her cough. Patient denied sputum associated with cough. Patient stated that sitting up alleviates the cough, while dust aggravates it. Patient stated that she needed assistance ambulating from her bed to her chair, and she sometimes became short of breath as a result. Upon examination, I found kyphosis of the chest, decreased chest expansion and symmetrical expansion, absence of cyanosis or other discoloration, absence of lesions, absence of tactile fremitus, absence of crepitus, bulges, and masses, normal tracheal sounds, trachea was not deviated laterally, decreased vesicular sounds accompanied by an intermittent soft wheeze, increased vocal fremitus across all posterior lung fields. Due to her recent diagnosis of diverticulitis and enteritis, it is important to assess her abdomen for signs of hernias as well as bowel sounds to ensure that her body is properly absorbing nutrients and that her bowel is not obstructed. Review of systems, abdominal system. Patient stated that her nutrition was adequate and denied feeling any abdominal pain for that particular morning. Patient stated that she has felt better since her endoscopic surgery but believes her bowel infections are giving her diarrhea. Patient denied history of past gastrointestinal disease and disorders. Patient expressed that her abdomen usually hurts after meals and before having a bowel movement and describes the pain as sharp and cramping. Patient stated that she is most often nauseous in the morning and that it subsides once she takes her medications. Patient stated that she enjoys coffee and her appetite has not changed, although she sometimes feels bloated after eating. Patient denies family history of gastrointestinal disease and disorders. Upon examination, I found an even distribution of hair, absence of cyanosis with normal skin color with several small brown lesions, absence of peristaltic waves and bulges, slightly rounded abdomen with equal symmetry, hyperactive bowel sounds in the lower quadrants, diminished bowel sounds in the upper quadrants, absence of bruits, absence of cutaneous hypersensitivity, tenderness in lower left quadrant upon deep palpation, rebound tenderness present, positive Murphy sign, and I was unable to conduct the obturator test due to the limited range of motion and pain in my patient's hip. In addition to the assessments of the respiratory and abdominal system, it would also be pertinent to conduct assessments of the neurological system and the musculoskeletal system. Pertinent System 1, Neurological System. My patient has recently been diagnosed with dementia and has undergone a mastectomy and endoscopic surgery. Conducting a neurological exam would show the cognitive level in which my patient is currently functioning and can indicate a cognitive decline. According to an article written in 2011 from Patient Plus, it is important to conduct a neurological assessment because it can be used along with the findings from other systems to determine a patient's risk for becoming delirious. Infections, poor mobility, movement to a new environment, dementia, and certain operative procedures are risk factors associated with delirium. My patient has recently undergone each of these situations, and a neurological exam will not only assess her mental status, but also aid in determining her risk of delirium. Pertinent System 2, Musculoskeletal System. A musculoskeletal assessment is necessary to determine my patient's level of strength and mobility. She is currently wheelchair-bound and unable to walk without assistance. Elderly patients who are not able to walk suffer bone loss and muscle atrophy in their lower extremities. According to an article written in 2008 from The Hospitalist, keeping patients moving is a step toward improving the quality of the patient's stay at the facility, as well as slows the loss of bone and muscle. Performing a musculoskeletal assessment can demonstrate firsthand her level of strength and tolerance of mobility while keeping her bones, muscles, and joints moving to decrease muscle atrophy and bone loss.